Hello, I'm Zaid Shalchi, and today we're going to be talking about the benefits of having cataract surgery privately over doing this in the NHS. So cataract is very common, and cataract surgery is the most common operation performed in the world. Cataract is where the lens of the eye becomes hazy, and cataract surgery is done to improve the vision by removing this haze and replacing the cataract with a brand new lens that will never need to be replaced. Surgery really is very effective, and patients are usually over the moon with the results. Now, the NHS provides very good cataract surgery, but private cataract surgery can have additional benefits. And today I wanted to talk about 6 reasons why you may want to have surgery privately. Reason number 1 is about speed. Generally, private cataract surgery can happen more quickly, usually within days or weeks from referral. And so if you're particularly troubled by your cataract and the reduction in vision, particularly about the impact it might be having on your life in terms of driving or your work, private cataract surgery may help cataract surgery happen more quickly compared to the NHS. Now, the second reason is the freedom to choose your consultant, because in private practice you get to choose your consultant in a way that's quite different from the NHS. And then you can stick with that consultant from your first consultation to the operation to any post-operative aftercare. And because you have that continuity of care, you get to develop a feeling of trust and comfort with that doctor. And there's also an element of consistency that can be very reassuring. Let's talk about the third reason, and that is a wider range of lens options. In general, the NHS will provide a high quality monofocal lens, which in general will be set for distance. But for patients who want greater independence from glasses after surgery, then in the private sector, you will have the option of a larger number of lenses. Particularly those lenses will be toric lenses to reduce any astigmatism you may have, as well as extended depth of focus lenses to give you good distance, as well as intermediate vision without glasses, or even multifocal lenses to get you out of glasses for distance, intermediate and near work. And so that's an advantage of private cataract surgery over the NHS. Now, the fourth reason is just about time. Because in the private sector, the doctor will generally have a bit more time with patients. The consultation will be much more personalized and will not be quite so rushed. So there'll be a bit more time to discuss your lifestyle and your visual needs and answer any questions that you may have. And of course, because this is done with more time, it will be a more bespoke service than you might have in the NHS. Now, the fifth reason is just the general environment. In general, in the private sector, there'll be more of a comfortable and calming experience. Generally, you will have access to much easier parking and soft drinks and warm drinks. In general, for the operation, you may be in your own private room. You'll have a bit more options in terms of scheduling, and certainly a bit more time with your consultant when needed. And all of that, of course, can be very reassuring when you're having a procedure which naturally can be associated with anxiety. And finally, the sixth reason is about aftercare. And although the NHS, of course, provides very good aftercare, the private sector, you'll have more options in terms of seeing your doctor and your consultant for aftercare, and that can bring with it a lot of peace of mind when your eye is healing after surgery. I hope all of this has been helpful in making you in helping you make a decision.